Welcome to Virtual Face-to-Face with Dr. Bruce Jarrell. I'm Alex Lukowski, Executive Director of Media Relations. Call it a second wave or the fall surge. The fact is, as the mercury is dropping, new cases of COVID-19 are rising, and rapidly, here in the U.S. and in a number of European countries. Here's what Dr. Anthony Fauci said last night on CNBC. If things do not change, if they continue on the course they're on, there's going to be a whole lot of pain in this country with regard to additional cases and hospitalizations and deaths. We are on a very difficult trajectory. We are going in the wrong direction. The U.S. reported the second highest number of new COVID cases on Saturday, right after its highest day on Friday, both days marking well over 80,000 new cases. And again, over 80,000 new cases yesterday, by the way. Week to week, at least 37 states are reporting higher rates of new cases. And those higher numbers aren't just because of increased testing. The Johns Hopkins Coronavirus Resource Center says in the 7 days ending last Sunday, compared with the previous 7 days, testing increased about 5.5%, while the number of new COVID cases increased 25.5%. So what's the impact? Well, while some Maryland school systems have been inching into at least some in-person learning, particularly for special needs kids, on Tuesday, children in Dorchester County on the Eastern Shore were the first in the state to go back to 100% virtual learning, as that rural county's test positivity rate surged past 6%. Across the country, the news is even worse. There seems to be a COVID storm on the rise, and we have to get prepared, said Illinois Governor J.B. Pritzker. All across that state, there are new restrictions on businesses at the state and local levels. And the same thing's happening in Newark, New Jersey, where the mayor is calling it a desperate situation. Over in El Paso, Texas, County Judge Ricardo Samaniego imposed a 2-week stay-at-home order and a strict curfew, citing completely full hospital ICUs. That state is now overtaking California with the most total COVID cases. In Utah, a group of hospital administrators has even told the governor they may have to start rationing health care in a week or two if ICUs continue to be flooded with COVID patients. And the list goes on, particularly in the upper Midwest and mountain states. In North Dakota, for instance, 5% of the entire population has already contracted the coronavirus, and it's only October. Now, we all knew something like this was coming, but we still have a lot of questions. First, the why. Is it the cold weather driving people indoors and into closer contact with everybody else? Or have Americans gotten lax in their adherence to prophylactic practices? Are we sick of staying at home and living in sweatpants, or are we just confused about what we should and shouldn't do to keep from getting sick? But more important even than the why is the what now. Back in March and April, people were afraid to go to the grocery store, have dinner with a friend, or even get a haircut. Remember that? So what do we do now? Do we keep all the kids home from school, cancel all travel? With the holidays approaching, do we finally have that ironclad excuse not to invite our sister's family over for Thanksgiving dinner? I am speaking hypothetically, of course, for anybody in my family who may be watching. And do we have to tell grandma it's just too risky for her to see her grandkids on Christmas? Well, that's why we invited our guest today to talk to us about the state of the pandemic and to tell us the truth about the risks we face and what we can do about them. Joining Dr. Jarrell today are 2 School of Medicine faculty members with wide-ranging expertise in this area. Dr. Megan Fitzpatrick is an infectious disease transmission modeler at the Center for Vaccine Development and Global Health and assistant professor of medicine. She's fresh off moderating CVD's 2020 Frontiers in Vaccinology conference this week. And Dr. Mary Claire Rogman, she's a professor of epidemiology and public health and medicine and associate dean for physician scientist training. She's also a staff physician and healthcare epidemiologist at the VA. Welcome to you both. I need to tell everyone first that this program is being recorded and will be posted on our COVID-19 recovery webpage, umaryland.edu/coronavirus. And a little later in the program, you, the audience, will be able to ask the doctors all your questions about the pandemic and how to stay safe. Just look for the chat button at the bottom of the screen, select chat with host, and write your question. When the time comes, we'll call on you to ask that question. I'll unmute your mic for you. All you have to do is speak up. Now, with all that out of the way, here's your host, UMB President, Dr. Bruce Jarrell.
Participating. Thank you for being here. And Mary Claire and Megan, it's a great pleasure to host you for this session. Let me start out with a doctor reminder. I got my flu shot this morning. I hope that all of you have gotten your flu shots. I hope that you all also are keeping your children immunized on schedule because in all of this pandemic, what we don't need is a case of measles or something like that. So please keep up with your immunizations. With that said, let me start off with Dr. Rogman. So Mary Claire, Thanksgiving's coming up. We always have 20 people in our house for turkey. It's a big event. What do we do this year?
So this is a tough one. So there's many ways of thinking about how to have Thanksgiving. And I want to start off by saying that we should all make sure that we actually have Thanksgiving, because we need to take some time to actually give thanks for what we have. This has been a tremendously difficult pandemic. It's been harder on some people than other people, but it's been hard on everybody. And so we need to celebrate Thanksgiving. Having said that, we need to do it in such a way that it is safe for everybody, okay? In doing so, everybody needs to take a family survey and find out who's at risk, okay? In my household, the person who is, or my family, the person who's most at risk is my 85-year-old mother. She has heart disease. She does not live in our household, but she lives nearby, and she would desperately love to eat Thanksgiving dinner with us. So we had a long, hard discussion about whether we could do this. So the one way I could think of, and that has been written about how you can do this to bring somebody who's at risk for severe COVID disease and eat dinner with them, which is typically done in a dining room inside, and we never wear masks while we eat, is to have a period of 14 days where you are not exposed to anybody. Not everybody can do that, and I could talk a little bit about how you might do it, but that would be the best way of bringing high-risk people in. Otherwise, we get creative. And we can talk a little bit about different ways that that could happen so that people can be with you physically in the same airspace.
I got to start next week, doesn't it?
Yeah, so we've got perfect timing.
Perfect timing. Okay, well, I'll keep that in mind, and I think all of our listeners should too. Dr. Fitzpatrick, a pleasure to have you here. You're a mathematical modeler. Maybe you could describe what modelers do and then talk about your particular interest in modeling schools and going back to school.
Sure. Yeah. Thank you for having me on this program. So modelers in the most basic essential thing about what we do is we turn what we know about an infectious disease from many different studies and many different sources of data into one formalized system. So we take all of the different pieces and we construct it together and we say, what comes out when you are really explicit about putting all of the different components together into the infectious disease system? And I think a way that has, of course, been really high profile during this pandemic has been drawing those epidemic curves, right? What are our expectations about R naught? What do we know about the incubation period? What do we know about the case fatality rate? And particularly those curves that we've been trying to flatten since March, which is the curve of hospitalization and ICU usage. And so that's really at its heart what we do. And we can use these models in two ways. And first I'll talk about the way that I don't use, and then a little bit about the way that I do and how I do it in schools. And so the way that I have been talking about is really forecasting, right? And so that's a kind of modeling where you try to ask what will happen in the future or what could happen under different scenarios. So I think many of us are familiar with the forecast models that predict what the epidemic is going to look like in a few months. CDC has a forecasting hub with great visualizations of that. And that is one avenue, is to try to say with some measure of precision what is going to happen. And that's pretty good at looking in the short term, but in the long term is really meaningfully influenced by the choices that we make. For instance, that Mary Claire just laid out about whether we collectively as a whole country decide to have big Thanksgiving parties or not. will influence what you should expect COVID to look like in the weeks following Thanksgiving. And that is hard to do. It's hard to make that prediction really precise. So I often take another kind of modeling, which is really about, not about forecasting, but about projecting, about asking, what if we did X, or what if we did Y? What if everybody in America had a 35-person Thanksgiving dinner without masks? What would it look like in the middle of December? Or what if everybody in America had a 6-person Thanksgiving dinner and everybody took precautions and was distanced as best as they could, in the space available to them? Clearly, neither of those are really true, right? We know that not everybody in America is going to do the same thing, even if we told them they should. But it's a way of asking how useful a recommendation might be. And so this gets to what we're talking about with schools. And so I'm looking particularly about the way that schools are set up or could be set up, the number of children that they bring together under different schedules, and the risk associated with COVID transmission under different assumptions about things like how many kids wear masks and what the adherence is and how well social distancing is put into place. And what does that mean for what we see in our schools? And what does that mean, given the data we have, that in fact, small children and our older students in high school have different risk levels for transmission and, for susceptibility and transmissibility of the infection? How does that play out in a school setting? What can we learn about the importance of interventions in schools and about things like how risky it is to open a school in either a hybrid or a full model? And so again, clearly, if that's not a crystal ball and that's not a forecast, those are what if situations. What if we could do this? What might happen?
Could you give us a taste of one or two of those scenarios relative to school?
Yeah. So, for instance, we have found that there's actually not a linear one-to-one relationship between putting in place things like these transmission controls. So, for instance, if you could put into place a suite of masking and social distancing such that you were able to reduce your in-classroom probability of transmission by half, that you actually have a really outsized effect on the transmission in your school, that you actually reduce your risk, or I guess what I should say, you reduce the number of secondary infections that you expect to see down to a third of your original estimation, your original expectation. And that's because you're not stopping just one generation of infection. We're not just talking about the first generation. We're talking about multiple generations. And so I think looking at that and showing really the power of the tools that we do have, if we can implement them with the resources it takes to put them in place and with really good attention to detail, is, I think, a really useful message when we talk about schools.
Thank you. Mary Claire, I know you've written a little bit about the 3 C's of prevention. Could you talk a little bit about that and help us bone up on our ability to take preventive measures?
So the 3 C's are crowds, closed spaces with poor ventilation, and close contact with anyone, particularly outside of your household. So first, I want to sort of start by kind of defining the idea of a household. Okay, a household, or a pod, as some people have called it, are the people that you have chosen to share the same airspace with, without actually taking any precautions such as wearing a mask while you're with them. So they're typically the people you live with. And you have to trust those people because your exposures are their exposures. So when you think about avoiding the 3 C's, we get into what we can do, right? So probably the most important thing that we can do, particularly in close contact situations, is to wear a mask, okay? And basically, people should be wearing masks when they are with people in a closed space. The only exception is those people who are in your household. So if somebody comes into your home that's not a part of your household, everybody should be masked. If you are outside with somebody outside of your household, like you're taking a walk with somebody, but you're within 6 feet, it's masking time. So I don't wear a mask if I'm in my office all by myself, like now. I don't wear a mask when I'm in a car by myself. But if I have somebody outside of my household in a car, I will wear a mask and I'll have all the windows down, no matter what the temperature is. All right. And if I'm outside alone, walking the dog, going for a run, I'm okay, no mask. I'll have one with me in case something happens. And then if you're outside, you're physically distant, and I like using the term physically distant because I want us to be social. I just need us to stay more than 6 feet apart. So if you're on somebody's deck or patio and you're more than 6 feet apart and you're socializing, it's okay not to have a mask on. I am always asked, how big's a crowd? Okay. And the answer is there's no one number for what a crowd is, because it really depends on what those people around you have been doing. So you want to limit the number of people you come into contact with that are outside of your household. And in particular, you want to limit contact with people with risky behavior if you know that. And then finally, as indicated, you want to be in the most ventilated space possible. So outside is better than inside. Inside is better with open windows. Inside is better with open doors than if you're actually in a small room. And I think that is one of the reasons why we're so concerned about the upcoming season, is we're going to be indoors more. So that's the 3 C's. The 3 C's have been used across the world. I think they originated in Japan, but I have seen them used in Europe and even in the United States.
Thank you. Thank you for that. I want to remind everyone in the audience to get your questions into Alex. We'll start them in just a couple of minutes. I want to get back to Dr. Fitzpatrick for a minute. So it seems like to me being in school could be similar to like being in an airplane and flying. Are there good models around what kind of risk you run there and precautions you should take?
So I think first I think I'll acknowledge that as Mary Claire was running through the 3 C's, I was mentally thinking that, well, that, schools violate all of those 3 C's, right? Every single one of them, which is why we are so concerned and trying to give so much attention to making those spaces safe. So I think, the thing that's different about a school versus an airplane is that many airplanes are created in a very standardized fashion, right? A 747, to my understanding, and if there's anyone out there who's an aeronautical engineer, please don't drop any questions in the chat box. But, to my understanding, a 747 has a ventilation system that looks very similar to another 747, especially one owned by the same airline. However, classrooms can be set up and configured extraordinarily differently. And so when you want to talk about what does it look like, what do the ventilation patterns look like in a classroom? What do we know about how exposure unfolds in a classroom? I got to say, which classroom? Are we talking about a school building that was built at the turn of the last century? Which may actually have windows that can open wide and you can let the air flow through? Or are we talking about a school building that was built in the 1970s with an energy conservation mindset where the windows don't open and the ventilation system is not up to spec? And so, these are entirely different contexts. And so there's really not a one size fit all approach to asking what the classroom risk is and who in the classroom is at risk if one person is infected.
Great, thank you. Not only can I not have Thanksgiving dinner, I can't fly to have it either. And I can't have my kids go to school for 2 weeks, right? I'm getting the picture here.
Distance learning.
Yes. Alex, I know we've got a few questions. You want to tee one up?
We do. this first one I'm going to read for Stephanie Seworth, who wrote. It's a little sad, unfortunately. She writes that my question is, how long after exposure would infection show up on a COVID test? My father passed this week. My mom is high risk, so we need to be together, but I don't want anyone to put her at risk, and total isolation for a few weeks is not an option for at least two members of the family. So what advice can you give for Stephanie?
Mary Claire?
So that's a tough one, and one that's difficult to answer without getting into a lot of different details. So I'm assuming that the person who passed away didn't pass away of COVID-19 in answering this. And so you want to know whether it's safe to visit your mother, who I'm assuming is at risk for severe COVID-19 because of either age or underlying medical conditions. So the answer is that it's difficult to be completely safe unless you are able to basically self-isolate or keep yourself from having been exposed for 14 days. Unfortunately, testing does not tell you whether it's safe for you to be with your mother. Testing alone will not guarantee, for example, if you test negative today, you could test positive tomorrow. And so that's not the best way. So we often talk about, the fact that, PPE, personal protective equipment, prevents transmission, but testing does not. So if you need to see your mother, I would do it in such a way that you avoid the 3 C's. Okay. And so, for example, when I go over to see my mother, who lives in an independent living facility, I get screened when I come in. I make sure I don't have symptoms, and I make sure that I don't have had any known exposures. I wear a mask. I wash my hands as I go into the facility. And then I am allowed at this point to go into her apartment, but we sit on her balcony 6 feet apart. It's a long, thin balcony, but we can still get 6 feet apart. And I know it is important for us to maintain contact in this particular types. You could do it without any risk if you were able to do video conferencing, but that's not the same. I know that. So the safest way I could describe it is the way I just did.
Thank you for that, Mary Claire. Alex?
Yes, well, a number of people have questions they want me to read for them, so I guess I'll do that. I always love hearing people's voices, but Priya Desarma writes, in the message from Dean Reese this week, he mentioned not to use neck garters. Could you please explain to us why this is not as good as a face mask, such as the wonderful ones I found online at the UM bookstore recently? I'm glad you like them. Which in fact, I have, I can't read what she wrote here. She has something that prevents glasses from fogging up. Thank you to Dr. Jarrell for the ones you sent by mail. And she also wants to add, how accurate are the rapid tests versus the PCR tests? So there's two different questions, but first, yes, I know there's a lot there, but these are all questions people have.
There's a lot to unpack there.
There's a lot to unpack, but first the neck garters. Why is that a bad idea?
All right, so I don't know the specific neck garter, and I will say that there is no regulatory agency that tells us whether our mask is as good, our homemade mask is as good as it should be. However, here are the things that are important about a mask. It should be at least 2 layers, okay? It should have a tight fit or a close fit around your nose and your mouth, okay? And, those are the critical elements. Many neck garters are not 2 layers. And you can test a mask that you purchase by just blowing into it. And if you can feel your breath on the other side, it's thin and it's not providing as much source control as one that has multiple layers.
By the way, she's telling me that she wrote nose piece. She has a nose piece that keeps her glasses from fogging up. I haven't seen that.
Those are great.
That's a great attachment. And then what about the rapid test versus the PCR test?
So by the rapid test, I'm assuming she means the antigen test. Rapid tests are great because they're rapid. And it is incredibly important for people to know their status as soon as possible because it helps them take action. Okay. Unfortunately, they are not as good at detecting infection as the PCR-based tests, which typically take 2 to 3 days to come back. Okay. So I tell people, and oftentimes when you get tested, if you get a rapid test, they will do a PCR test simultaneously. In which case you should hold off on doing anything in which you think you might expose somebody until you get the PCR test back. But I will come back to this, even when you know your status, so to speak, you only know your status on that one day, and you still need to be using what we know reduces transmission.
And I think the other recommendation we've had is if you have a positive rapid test, it should definitely be confirmed with a PCR test. And if you have symptoms and it's negative, you better check it with a PCR test as well. I think that's been our general guidance on this.
Correct.
Dr. Fitzpatrick, anything to add to unpacking this question?
Yeah, I mean, I think that Mary Claire hit it on the head. That's, yeah. And also what you said, if you have a known exposure, it is so important that you continue to isolate for the CDC recommended period of 14 days following a known exposure, right? So because we know that there's a lot of variation in how long it takes a person to develop symptoms or how long it takes for the viral growth in themselves to reach a level that could be detectable by a test, by either test, the PCR or the antigen. And so if you've been exposed, if you've had contact with somebody that you know has a positive COVID test, you really need to adhere to that 14-day period, even if you get a negative test at day 5 or a negative test at day 6. It's, you've got to follow that 14-day period through.
I would add to that, it does need to be a sustained high-risk contact. And by that, we say at least 15 minutes. That 15 minutes can be continuous or it can be additive. But I just want to let people know that walking past somebody who's COVID positive on the street does not constitute need for quarantining for 14 days.
All right, thank you for that, both of you. Alex, next question.
All right, let's go to Nancy Hannafin. Nancy, are you there? You've been very patient. Nancy?
Oh, sorry. No, you can hear me now. Okay. So I'm just wondering about the CDC guidelines that came out last week. So, and you just mentioned a little bit about the cumulative effect of 15 minutes of exposure. And I'm just wondering how that's going to apply to the classroom as an educator where we do hybrid classes. It seemed like we're already practicing that. And now I'm not, I think the lines for me are a little blurred.
Should I take that one?
Go for it, Megan.
Yes, please, Megan.
So I think if you're asking about the new CDC guidance about the 15-minute cumulative versus 15-minute in chunks, I would hope and expect, I suppose, that most schools, when they do have in-person instruction, are in fact cohorting students, and the expectation is they should be. The advice is, my recommendation is that students be cohorted in such a way that they are spending the majority, if not all, of the day with the same individuals. And so when you ask about how that guidance should change what unfolds in a school, my first response is, well, in a classroom, a child should be in that classroom for several hours. And so this consecutive versus non-consecutive distinction should no longer be a worry, or I guess it shouldn't constitute a change for most people in a school setting. If you have a more specific situation that you're thinking about, I would appreciate some clarification. I can't hear you if you happen to be on mute.
I would also add that people with COVID-19 are most highly infectious for probably about 5 days. And then they become non-infectious if they have a mild case after about 10 days. So there is, you know, when we're talking about this cumulative 15 minutes, it is over the time in which you think you were exposed to somebody while they were infectious.
Well, since you're talking about the amount of time that people are exposed, we had an anonymous questioner ask, what if you know you're going to be in close contact with someone for up to 4 hours, like a stranger? Would an N95, if you're both wearing them, and a face shield, would that make it safe? What should you do to be safe? Doesn't explain the 4 hours with the stranger. I don't know the circumstances.
You should avoid the 3 C's. You should, so I would, you know, the things I would be thinking about. So first of all, I will comment about N95s. So in order for an N95 to be better than a surgical mask, it needs to be fit tested. And it needs to stay fit tested for a long, you know, for the entire time you're there. When I am seeing a patient in the hospital with COVID-19, I wear an N95. I put it on, I fit check it, I make sure that I'm, you know, not getting any air around the mask at all. I go in, I see the patient, I leave, and I take it off and I take a huge deep breath because it has been difficult for me to breathe because I had an N95 fit tested on me. So you aren't, you will not be able to have a completely fit tested N95 on for 4 hours is my point in that statement. I would make sure of it, if you did need to meet somebody face to face, I would do it outside if possible. Okay. And then if I couldn't do it outside, I would use the largest room possible. I would ask whether it was critically important to meet face to face. For example, in my nursing home residence, we've converted most of our follow-up visits to telehealth visits just to get away from this. So all of those aspects are important. And of course, a face mask should be used by both of you, and it should be a good face mask as I described. And if you feel like an N95 is providing a closer fit, so be it.
Yeah, and Mary Claire, I noticed you didn't say they should take their temperature and you should screen them for symptoms.
Well, no, that's an excellent idea. I'm not a big fan of taking temperatures, only because in all the temperatures that have been taken in our nursing home, for our staff members, I've never once detected any of our cases that way. I have detected them from symptoms. So your point is well taken that people, that you should screen for symptoms. And if there are any COVID symptoms, then the meeting should be canceled. Having said that, we know that people are infectious during a pre-symptomatic phase of COVID-19, and so it's not perfect.
Right. Okay, Alex, let's move to the next one.
All right, we have a complicated question from Sengmar Akbazian. Are you with us?
Yes, I'm here.
Okay, go ahead.
Yeah. First of all, I would like to thank President Jarrell and the panelists. Thank you for taking care of us and also for arranging this panel. My question is a little bit unique. I have a special needs child, and we suspended therapy sessions for our child in March, you know, when the pandemic got worse. And we're now considering to restart therapy, but most companies that provide services for children with special needs, they provide masking, but that's pretty much it. So my question to you is, how do we keep our family safe if we restart therapy for our child? Because most of the time the therapists need to sit close to their children.
So I will let you know what we do with our nursing home staff. Okay, so most nursing home clusters or outbreaks of COVID-19 happen when an infected staff member works while they're pre-symptomatic. And so you would put in place practices that are similar to what we use in nursing homes. And I'm going to acknowledge that we have to provide the care that people need. And so although we may not be able to do this in a risk-free fashion, there is always, we have to look at the risk benefit. Okay. And so there's the benefit of having this care provided for your child. So I would make sure that that you screen the therapist who is coming over. You make sure that they have a surgical mask, and that you use the best possible location for this therapy. And again, the best possible location would be outside. And then slowly as you come back in, having as well ventilated a room as possible.
Dr. Fitzpatrick, anything to add to that?
No, I think I think Mary Claire gave better advice than I could have, having a real world experience in a care setting.
Gotcha. Okay, Alex?
Well, unfortunately, we have people. I would love to be able to go to Ashley Vallis right now. She's in the audience, but she's having a problem with her mic. So I'm going to read this question for her. She says, I'm a huge believer in the science, but I also know that Catholic schools have been back in session in Baltimore since September. And so far, they haven't had to close for any huge outbreaks. Why do we think that is?
Yeah, that is such an excellent question and an excellent observation. And so I think that one of the important things that I have learned, and this is not a thing necessarily that the science tells me, but it tells me that operationally, the challenges that are facing schools have a lot to do with the resources and the flexibility available to them, as well as the number of children per class, the student to teacher ratio that is existing at the start, that was existing before we even began, as well as the quality of the building, the air quality, the ventilation options available. And it is often a lot easier for individual schools to find the flexibility to develop the protocols that they need to have. And it is certainly easier for well-resourced schools or school systems to find the PPE, the disinfection, and the other supplies that they need to open safely. I think looking at our Catholic schools is it gives us a lot of really important information. I would love to have a lot more thorough information about whether they are detecting infections in those schools. You've noted correctly that none of the Catholic schools in Baltimore City specifically, to my knowledge, have closed, but I do think some classrooms have closed, and I do know that a high school in Anne Arundel County has closed for outbreaks. So, we do see some things, but I would first of all love if anyone has access to, if any of you are on, working with the diocese, you give me a call to have the information about what is being detected. But again, I want to reiterate, what I find is that individual schools, particularly private schools, are often able to mobilize the resources to get masks on those kids, spaced desks, protocols in place in a way that their schools can implement. They're able to perhaps either have windows that open, or they have buildings that are already well ventilated, or they can move their classrooms outside to outdoor space. I've seen so much creativity in moving classrooms outside in the private school space that I think is really hard for a county level to prescribe. And so, that's what I see when you say, I'm not going to say that it's about the science. It's really about the operations, the resources, the investment, and the logistics of making sure that those safety protocols can be put in place for children at the district level.
What a great answer. I really like that answer. It's common sense and good advice to follow. Alex?
Well, Mary Claire pointed out that many of us are, I think, most concerned about elderly family members at the holidays. Elaine Bundy is here with a question about that. Elaine?
Hi. Yes. I have an elderly family member that lives in assisted living. She's almost 100 years old, and there's no immunization administration capability at the facility. And she's she hasn't left the facility in probably almost a year now, just becoming frail. And I just am wondering, is it possible, is there a safe way to get an influenza immunization to her, like with a home health nurse? I don't know if that's even possible. Just thought I'd ask the question.
So your assisted living facility should have an administrative director, and they should have some mechanism for getting their, their residents vaccinated. And that's where I would start.
Right.
Not an unusual situation. And it is, again, I come back to the idea, we're trying very much to limit exposure of our vulnerable older relatives. But we do need to make sure that people need care, and they need to get that care. And so I would say that, the risk of sending, having somebody go in and do vaccinations in that assisted living facility would be worth the risk.
Right. Thank you.
Thank you, Mary Claire. Alex?
Well, we have an anonymous questioner who wants to get the real number. She writes, even if we, she says, even if we take reasonable precautions as much as we can in order to get a few non-household family members together for Thanksgiving, is there a state COVID test positivity rate that would be alarming enough for you to recommend that we do not get together with those outside of our household, even if we avoid the 3 C's? So what's your magic rate? What's your comfort level? She's really saying, what would alarm you? What would be a level that you said, oh no, that's over the line. I can't do that.
So we've been in the percent positivity about 3.5% right now. We are slowly inching up as we and our hospitalizations have been increasing. So I'm going to come back to this idea that it's not actually the number of people you're getting together, but what they have been doing and where they live. COVID-19 is a very regional disease. I think it was mentioned at the beginning of this that Talbot County has one of the highest percent positivity rates in Maryland right now. If you have somebody, a relative in Talbot County, you do not want them coming and sorry if I'm causing family strife, but that is not necessarily a good idea to have at your indoor dinner table. Having said that, if everybody that you've invited from all of these different households has been has had no known exposures, and they have been careful over the 14 days prior, even if we have an increase in our percent positivity, you should be safe. Again, it's not risk-free. And I think that, for example, my tolerance of risk is very different for my mother than it is for the rest of my household.
Megan, that has modeler written on it. You got any other comments to make about the prevailing rate?
Yeah, so one of the things that I really want to mention is that my metric for what's safe and what's not safe, or I should say my indicator, is actually not the test positivity. So to me, the test positivity tells me, are we doing enough testing to know accurately what's happening? And so certainly when that goes up, especially if it goes above, say, 5 or 6%, I'm going to say, this outbreak is so bad, we don't even know what is going on with it. But before that, we could know, the number that I actually look to every day I check it. But I'm an epidemiologist, you don't have to check it every day, is the 7-day moving average case rate per 100,000 K. And you can see it on the Maryland State Coronavirus Dashboard, and it's available by county as well on the coronavirus dashboard. And so that number to me, if the percent positivity is good enough that we know what's going on with some precision, that number tells you what the case rate is in your population. You can see how it's been unfolding over the course of the epidemic. And so, for instance, even though I'm going to take the risk of mentioning another county, even though I think at the end of this program, we may no longer work for the state. So the county that's causing me the most alarm right now is the one with the highest 7-day moving average case rate per 100,000, which is Dorchester, which has a 7-day moving average case rate that's up in the 30s. And so actually, well, I think it just slid under 30 today, but that's alarmingly high for the state as a whole. We're at 12, which is an uptick from 9, which is where we had, we've been oscillating between about 9 and 11. So I recognize that's a lot of numbers. You can go look at the trends yourself, but I'm going to say it again one more time and then try to keep this answer concise. The test positivity tells you whether we know anything, right? And then after you look at that number, you should go over to the 7-day moving average and say, what is it that we know, right? What is it that we think we know with some precision? And look at that trend and how many cases are being detected over time.
So I'm just going to throw in 2 things. Number one, I got my counties wrong. I took a vacation in the other county, and that's why it was on my brain. And the second comment I would make is I typically check these numbers once a week, only because I then can look at trends, because it's not just the absolute number, it's what it's done compared to last week. And the reason I don't check it every day is there's too much wobble.
Wobble. That sounds like a scientific term. Okay, Alex.
Dr. Jarrell, I'm worried that Megan may have sort of put some cold water in your Thanksgiving plans, huh? I think we both know people in Dorchester County. So our next questioner is Leilani Uttenreither. You know her. Leilani, are you there?
Hi, Leilani.
Hello. Hi, Dr. Jarrell. Hi, Alex. Thanks for having me on again. My question is about the Pfizer vaccine trial and what this panel's thoughts are on them including children as young as 12. I read somewhere, which I read that some experts disagree that we should be including children as young as 12 on the vaccine trials at this moment. And also, do children need a vaccine for us to reopen schools and go back to normal, since I don't expect to see a children's vaccine until late next year?
Mary Claire, any comments on that?
So I'm not a vaccine expert, but I will say that there's 2 reasons to give vaccines. One is to prevent COVID-19 in people who are likely to get a severe case. And then the second, which is probably almost as important, is to prevent transmission. So if it turns out that children 12 to 18 are super spreaders or, are likely to spread, then vaccinating that group is actually going to be extremely important to helping us control the pandemic.
We'll save that one, Leilani, for the next vaccine discussion again. Okay, thank you. Alex?
All right, Dawn Rhodes has another gut check question for you. And that is, would either of you get on a plane and travel this holiday season? Be honest, please.
I'll go first. Not on your life.
That's clear. Mary Claire?
I have no reason to. And
that's dodging the question, Mary Claire.
All right. So the answer is, if I needed to be on the West Coast for something very important, I would do it. Let's say my brother lives on the West Coast. If my brother needed me to help him with something that I could only do in person, I would do it. Okay. Would I do it for a holiday gathering? No, because I can come up with acceptable alternatives.
I think that that's a really important point, right? So again, if you said, would I get on a plane this holiday season? I mean, I wouldn't get on a plane so that I could do Thanksgiving with my uncle in Hawaii, who I'm sure is not watching this. Sorry, Joe. But, but yes, there are things that are really important to our lives and people that we do need to show up for. And that's a higher bar. I think we know that the Thanksgiving travel season can lead to a lot of crowded, congested, busy airports. And even if that's less so than usual, it's still going to be a lot worse compared to the risk that most people bear in their everyday lives. And so I would definitely ask yourself if you have to go.
Well, yeah. You'll be glad to know that Southwest Airlines is going to start filling the middle seats. So there'll be plenty of room for you. Let's see, your next question, Mary Phelan. Mary, are you there?
Hi, thanks for taking my call. For me, the holidays traditionally mean baking treats for my neighbors or participating in a cookie swap. Would people not eat any homemade treats this year? Is it safe to eat homemade goods? Should I even bother with trying to spread some joy in my neighborhood? Thanks.
Spread the joy.
Can I be your neighbor?
Megan.
Yeah, there's no risk to you giving out those yummy baked goods. The risk would come is if you had an indoor cookie swap with no masks on.
I was with a fellow the other day. The military guys usually give you little coined medals at the end to say, remember me, it's Colonel so-and-so, on a little coin. And so he put the coin in his hand, and then he took a squirt bottle of stuff and spread it on there. And then he went over and shook your hand. Okay. And I thought, wow, that's pretty interesting. I don't think I'd do that. But anyhow, people have different ways. Alex?
Yes, they do. We have a questioner who wants to know, you talked about the 7-day moving average cases per 100,000. What number is a concerning number for you as a cutoff, knowing that the trends are important as well? He writes, I know that, or she writes, I know that New Jersey is using a 10 over 100K as a cutoff. What do you think about that?
I guess my question is a cutoff for what, right? So if, as Mary Claire said, if somebody needs you, right, then you go. But also there's there's certainly a lot of things that I would do at a case rate of 2 per 100,000, which we have not a space we've been in, that I wouldn't do at 10. And so I acknowledge that those are differences. I think the important thing to understand is that there isn't a cutoff because this is the sliding scale, right? So there's not a magic number at which things suddenly transition from being, not risky to definitely risky, right? So when you move from 10 to 11, when your county average is moving from 10 to 11, your risk is 10% higher than it was the day before, or before when you measured at 10. And so that is not like, it's not a cutoff. I would say that I am always concerned at about the level of 10 per 100,000. So I've been living in a state of concern in the state of Maryland for some time. As we bounce and oscillate, I don't think, when you ask about what my personal risk tolerance is, I will tell you, I don't do a lot of things that I would otherwise like to do at a rate of 10 per 100,000. I would love to see us move towards a space where we are under 5 per 100,000, and I would feel a lot more comfortable because the risk would be half, doing a lot more activities. I would be thrilled if we could get to 1, right? And I know, I just really want to emphasize this is not a dichotomy, right? There's not a space where it suddenly transitions to very risky, but I think we have been living at levels that warrant precautions here in the state of Maryland for a long time.
So Megan, should we go to the Ravens game if we get a ticket?
No. Look, I don't know. I wouldn't, because I would be myself very, I will tell you, I have not investigated whether what the procedures are to, are they tickets that you flash? Are they tickets that you, what does the seating look like? I have myself, a strong aversion to telling people that I don't know, that they're too close to me, or to, if we could take a step back and have a little bit of space, or if they could please put their mask on, or I think that your seat number was actually that other number. And so I myself would not go, because I don't have control over other people's behavior. And that's a lot of other people whose behavior over which I would have no control. And so your mileage may vary, right? Mary Claire, I don't know if you have a different perspective on that.
So, I have a perspective as to how much joy are you going to get out of going to that Ravens game? Is it worth it? I think Megan's completely correct. It depends how the stadium is set out. It is outdoors. Okay. If they were actually able to have 6 feet apart and masks were worn, I actually think it would be a safe activity. But will that happen? And I like the way you put it, Megan.
Wow.
When I watch the TV of the college games, I don't exactly see very good behavior there.
I think that's a correct observation.
Gotcha.
We have so many questions, we could go another hour, but I think you need to hear from Sarah Stern O'Connor. She's got probably the most complicated, I don't know if it's going to be difficult for you, but it is a complicated question. Sarah, are you there?
Yeah, can you hear me?
Yeah, absolutely.
Hi, I am pregnant and due in January.
Congratulations.
I have done a very good job this semester of keeping myself and my family sort of away from everybody because of the pregnancy, and also because we have some high-risk caregivers. My mom would like to come up for the birth, and I'm concerned about it because in our area, if I get infected, I won't be able to hold or be with the baby when she's born, which I understand from a scientific perspective, but I think that is terrible for both me and her. And my mom would like to come up from Florida. She originally wanted to fly. I told her that was out of the question. And so she's going to drive. And my question is, how concerned should I be about getting infected, like her getting infected along the drive? Should I make her wait, 5 to 7, 10 days to see if she has symptoms, have her get tested at that point? Do you have other suggestions? Should I have her get tested in Florida?
So I would do exactly what I was describing about bringing households together, particularly if there's a vulnerable member for Thanksgiving. If your mom is willing to severely limit her exposure to other people while she's in Florida, okay, for 14 days, all right, that means that she can't work outside the home. She could exercise outside, but not go to gyms. She'd have to do online shopping to stay out of stores. She could do curbside pickup. She could do curbside takeout, but there would be no going into restaurants or bars. And everyone in her household would need to do that, or she would need to stay away from those people in her household. If she does that, and then she drives through and follows all of the precautions we've talked about in terms of masks, physical distancing, then you've got the best, that's safer than having negative tests. Okay. And I bet you she's got a powerful incentive to do that.
Yeah, and I'll speak in about driving through. So without knowing what part of Florida she's in, it could be a drive that's longer than one person would safely take in a day, because you don't want a car accident either. there are a lot of Airbnb style rentals along the way that often have like a contactless check-in, so she could rest on the drive up. There are, without knowing her route, again, I can't say.
She says Orlando. Orlando, that's a long drive for one person.
Yeah.
But you could do overnight.
Yeah, overnight,
Yeah.
yes, but in one drive, no.
In one
Orlando's a
drive. And
tough-
so I'm
tough
just
drive.
pointing out that when we say drive through, we mean also drive through safely, right? Stop, be creative about the places you stop. And, you know, even a lot of the hotels have a lot of COVID precautions in place. Do a little research to find one that's safe if you can't find a contactless entry style Airbnb. And I think that's a really important question that I get a lot is, do I have to camp at the side of the road on my long driving trip to X destination? And the answer is no, there are solutions. Please do make sure that your daily driving hours are commensurate with your safety.
Alex, I see we're just about out of time. Do you have one burning question?
Well, I have a burning, you're very good at reading my face now. I have one burning question because so many people have asked, just quick yes or no, trick or treating.
Saturday night.
Should they do it? You know,
Yes.
yeah, Saturday night.
I think.
Again?
Okay.
But yes or no? Yes, but keep the candy outside. Don't bring people into their houses, right? Don't walk into the door. Don't wait for kids to knock. Outside with the candy, and no costume masks. The real masks. Paint them. Maybe don't paint them. Sorry, no, don't paint them. You can get a lot of really creatively decorated costume style masks, but make sure that they're the cloth masks. Darth Vader doesn't cut it.
You can put something over the cloth mask. I mean, you can put something as long as it doesn't interfere with it, right?
Right.
So you know, you can still be creative.
Mary Claire, you trick or treating or not?
Absolutely. This is the perfect holiday for COVID. Okay. It's outside. You can wear a mask as a part of your costume or under your costume. You can trick or treat with your pod, okay, or your household. You know, at the house, you know, if you're handing out candy, completely agree. Do it outside. No, I don't think you need to, you know, wash the candy first. That person handing out the candy should have a mask on. If you want, you can put it on a table and stand 6 feet away.
Gotcha.
Yes, we are putting out a table that we're going to decorate to look like a ghost with a white tablecloth.
Yeah.
And, you know, putting candy out that the kids can come grab while we wave at the costumes in our neighborhood. So, so that's, yeah, I think this is so much easier than Thanksgiving. So take
Absolutely.
All right. Well, with that, that's a great closing question, Alex. Thank you for that one, whoever gave it up. Mary Claire and Megan, thank you for such a delightful hour. It was very informative and entertaining at the same time. So thank you very much for that. For our participants, again, thank you. We'll see you. Are we next week too, Alex? I think we are, aren't we?
We are. We are next week is a special show. This is
yes,
Michael Steele talking about you know, the election and the campaign season and politics and all that, and he's ready to go. So that's a good one.
Gotcha. Okay, so I'll see you all. Thank you again.
Thanks, everybody.
Thank you.